Hello and welcome to my channel, and today we will be discussing about morphological uterus sonographic assessment, which is an ultrasound criteria for adenomyosis. Now we all know that in adenomyosis the gold standard of investigation is histopathological examination, and it can be confirmed only after histopathology of the uterine specimen. But there are very few patients which undergo hysterectomy, so non-invasive investigations are needed to diagnose adenomyosis, which include ultrasound and MRI. In ultrasound also, transvaginal scan is better than transabdominal scan. What happened is management was usually dependent upon ultrasound alone. So there was a need of a standard uniform system that could actually diagnose adenomyosis and the features related to it. So came the MUSA classification system. It has got 9 features. I'll be elaborating all the features one by one. Let's see in this diagram. The first feature is globular enlargement of the uterus. Second feature is asymmetrical thickening. The anterior wall is less thickened compared to the posterior wall. This is what is known as asymmetrical thickening. So two features on the basis of thickening of the uterus. First, globular uterus, and second is asymmetrical thickening of the uterine walls. Third feature is interrupted junctional zone. Now junctional zone is a zone between the endometrium and myometrium. When this zone gets interrupted, it's called as interrupted junctional zone. And fourth feature is irregular junctional zone. There is irregularity. At some places it is thin and at some places it is thicker. Fifth feature is fan-shaped shadowing. Sixth is hyperechoic islands. Now, when this endometrium gets inside the myometrium as an ectopic tissue, this endometrium is usually hyperechoic. So whenever there is a lesion of the endometrium inside the myometrium, it is identified as a hyperechoic patch, and that is called as hyperechoic island. Seventh is subendometrial cyst and lesion. The endometrium comes in the forms of cyst and lesions. I'll later elaborate what a cyst is. Then intraregional vascularity. Ninth is subendometrial lines and buds. Now all these 9 features are divided into 2 basic types. First is the direct feature and second is the indirect feature. Direct features are the features that are caused because of the presence of endometrial tissue as an ectopic tissue inside the myometrium. They are the features which indicate its presence, which includes 3 features: subendometrial lines, subendometrial buds, and subendometrial hyperechoic islands. Buds, lines, and islands. These are the direct features. Now, indirect features are the features which are reflected in the myometrium because of the presence of endometrial ectopic tissue inside the myometrium. These include the other 6 features, which includes the globular uterus, asymmetrical thickening of both the walls, irregular junctional zone, interrupted junctional zone, fan-shaped shadowing, and intralesional vascularity. These all features are secondarily created because of the direct features, so they are called as indirect features. What we also see during ultrasound assessment includes 6 other parameters, which includes location of the adenomyotic tissue. It can be in 5 of the walls: anterior wall, posterior wall, left lateral wall, right lateral wall of the uterus, and the fundal part of the uterus. So location you have to tell. Then second is the differentiation. Differentiation includes focal, diffuse, or mixed. Focal means whenever the adenomyotic foci is having more than 25% of its wall surrounded by myometrium. Diffuse means when less than 25% of its wall is surrounded by the myometrium. And sometimes when both these features are present at different locations in the uterus, then it is called as mixed adenomyosis. Now coming to one point, what exactly is adenomyoma? Adenomyoma is actually focal adenomyosis that is surrounded by hypertrophic myometrium. The third feature which we see is whether the adenomyosis is cystic or non-cystic. Now cystic means it will be having cyst, the diameter of which will be more than 2 mm. Then they will qualify as cyst. Also, when they will be having a fluid that is anechoic or of lesser echogenicity and is surrounded by an echogenic border, then it qualifies as a cyst. We always have to tell whether this adenomyosis is having cyst or not. So in the ultrasound, it should be mentioned whether this adenomyosis is having cyst or is it non-cystic. Fourth feature is the uterine layer involvement. Now we'll understand the layers one by one. Supposingly this is the uterine cavity. Outside the uterine cavity, there is the endometrium. This is the myometrium, and the myometrium has got 3 basic layers. One is the inner layer, then is the middle layer, and then is the outer layer. The layer which you see in between the outer and the inner myometrium is actually a vascular layer or the vasculature. So vasculature is present between the outer and the inner myometrium. Now revising the layers one more time. Inside is the uterine cavity. Outside the uterine cavity is the endometrium. Then comes the myometrium, which has got 3 layers: inner myometrium, middle myometrium, and outer myometrium. Between the middle and outer myometrium, there is a vascular layer. And outside the outer myometrium is the serosa. On the basis of the involvement of the layers, there can be 3 types of adenomyosis. Type 1 is when the adenomyosis involves only the inner layer of myometrium. Type 2 is when it involves the middle layer of the myometrium. And type 3 is when it involves the outer layer of the myometrium. The fifth characteristic is the extent, that is the amount of uterine corpus that is being affected by adenomyosis. If it is less than 25%, it is mild. If it is between 25 to 50%, it is moderate adenomyosis. And if it is more than 50%, then it is severe adenomyosis. And the last character to be described is the size of the lesion. So the largest diameter of the lesion has to be recorded. Now these are the features and the characteristics that have to be described in an ultrasonography of an adenomyotic uterus. Let's revise the features once again. It includes 9 features, direct and indirect. Direct includes 3 features, which are directly caused by the presence of ectopic endometrium in the myometrium. They include subendometrial cyst, subendometrial lines, and subendometrial hyperechoic islands. Indirect features include 6 features, which includes globular uterus, asymmetrical thickening of the uterine walls, interrupted junctional zone, irregular junctional zone, intralesional vascularity, and fan-shaped shadowing. What all features to see in an ultrasound of an adenomyotic uterus includes the location of the lesion, the differentiation between focal, mixed or diffused, whether it is cystic or non-cystic, the uterine layer involvement, the size of the lesion, and the extent of the involvement. I hope you were able to understand the MUSA classification system. This is a very important recent update in the topic of adenomyosis, which you can get in any exam. In fact, the direct and indirect features were asked in INISS in 2025 also. So I hope you understood it well. Like the video, share the video with your friends, and subscribe to my channel. Also, these notes are going to be available under my subscription channel on Instagram. So if you want any notes, you can just join my subscription channel. Let's study together and grow together. Thank you.